Welcome to Caregiver Chats. Today I'm talking about hearing loss, so stay tuned and we'll get into it. Hi, Dr. Lakelyn here. I'm a gerontologist and caregiving advocate for Home Instead, an honor company. Today on the Caregiver Chats podcast, we're delving into a topic that affects millions of families worldwide, hearing loss. As caregivers, it's crucial to understand the prevalence, challenges, and resources available to support our aging loved ones who may be experiencing this issue. Many people think that hearing loss is inevitable as we get older. And while yes, it is more common to experience decline in our hearing as we age, there are varying degrees of hearing loss, and it's something we cannot ignore. We need to make sure the loved ones we care for are getting regular hearing screenings because untreated hearing loss can have serious health implications, which I'm going to dive into in just a bit. When it comes to the prevalence of hearing loss, according to the National Institute on Deafness and Other Communication Disorders, nearly 25% of those aged 65 to 74 have some form of hearing loss, and 50% of those 75 and older have disabling hearing loss. Also, according to the World Health Organization, globally, more than 1.5 billion people experience some degree of hearing loss. And when I dug into these numbers, I thought to myself, since hearing loss is so common, why aren't we talking more about this? For that reason, I feel it's important for caregivers to be aware of the signs of hearing loss and be proactive in addressing this issue. So let's talk about the signs. And some of them are more obvious, while others not so much. One obvious sign is when a person asks, "What?" and they do so frequently. Also, when they ask people to repeat often or ask them to speak louder. Again, those are obvious signs. Another obvious one is when they're struggling to hear the doorbell, the phone ring, or other everyday sounds. Also, when the television volume is really, really loud, this can be another obvious giveaway, and it can also be a little frustrating for you as the caregiver. However, the older adult might not notice just how loud the TV volume has gotten, and they might need someone to just point it out to them. They may also say that the person they're talking to is mumbling or say, "It's too loud in here." And if that happens frequently, it can be cause for concern. And this may also lead to changes in their behavior, such as increased irritability or frustration, and this could all be tied back to their hearing loss. Now, some of those not so obvious signs can actually be similar to the symptoms of cognitive decline, such as confusion, answering questions inappropriately, and becoming disinterested in socializing. What's interesting to note is that age-related hearing loss often starts in the higher frequencies. So they might be having trouble hearing women's voices and children's voices because they often speak at those higher frequencies. Another thing to look for is if the individual can hear the other person talking, but they do not understand what's being said. That might be because they cannot process what they're hearing fast enough to keep up with the conversation. This might result in misunderstanding or misinterpreting what others are saying. Because of this, socializing and talking to people can become exhausting for a person with hearing loss. If you think about it, for many of us, hearing is passive and something we can do while multitasking. You might even be multitasking right now as you listen to me. However, if you're hearing impaired, it requires more concentration and focus, which can be tiring, especially on days with a lot of activity. And for this reason, another sign could be that if an individual starts to withdraw socially, it might be because of their hearing loss. And this is a big problem because it can lead to isolation, which is a significant issue. In just a bit, I'm going to offer up some tips to hopefully help improve communication and avoid isolation. One last sign that you might notice is that the person hears better at home than out and about in loud areas with a lot of background noise. So as a caregiver, it's important to be observant of your family members' hearing and also to be proactive in addressing potential hearing loss. The earlier we can intervene, we can focus on ways to improve the person's quality of life. So if you see any of these signs, encourage your loved one to schedule a hearing evaluation with their healthcare provider. A professional assessment can help determine the severity of hearing loss, and then you can work with the provider to determine the treatment options. There's even a phone test you can do to get a good baseline assessment of hearing. You can learn more about that on the National Hearing Test website, which is nationalhearingtest.org. And I'm going to link to that in the show notes. So now that we know the signs of hearing loss, let's talk about some of the challenges that hearing loss can present for the individual and the caregiver. First, it can have a significant impact on communication. You might find your communication has become strained, and it's leading to a lot of frustrations and maybe even feelings of isolation for your loved one. And as a caregiver, you might find yourself constantly repeating information or struggling to make yourself understood. Now, this can be exhausting and emotionally taxing for everyone involved. Another challenge is the stigma attached to hearing impairment. Your loved one might be embarrassed by their hearing loss and might try to hide it. They may also shut down when you try to bring it up with them. An additional hurdle is that caregivers may interpret this hearing impairment as signs of dementia. And the two are actually linked. There has been some research on this, and in the aging field, there seems to be some debate when it comes to hearing loss and whether it causes dementia or whether dementia causes hearing loss. Kind of like that chicken or the egg debate. What comes first? Studies have found that hearing loss is associated with a higher likelihood of developing dementia. Even mild hearing loss can make a person twice as likely to develop dementia, and those with more severe hearing loss have an even higher chance. But the good news is if we can treat hearing loss, we can reduce the risk of dementia. Research has also found higher rates of hearing loss associated with comorbidities. And that term means that a person has hearing loss in addition to another chronic condition such as diabetes or heart disease. And they've also seen higher rates associated with isolation and depression. So if your loved one has a diagnosis of any of those, it's really important to be attentive to their hearing. And one challenge you might not think about is that people with hearing impairment are at a higher risk of falls. They're actually 3 times more likely to have a history of falls. In the ear, balance and hearing are directly connected. They actually share a common nerve pathway to the brain. So that's why you see a link between falls and hearing loss. So again, if we're able to address the hearing impairment, then we can likely also decrease that person's risk for falls. One final challenge that I've mentioned already is the stigma that accompanies hearing impairment. This can make it really hard for caregivers to broach the topic with their loved ones. So next, I want to share some tips, strategies, and tools that can help caregivers support their loved one with hearing loss and improve communication. But first, a word from our sponsor. This podcast is brought to you by Home Instead, an honor company. If you find yourself needing extra support as a family caregiver or time away from your caregiving responsibilities, Home Instead can help. Our home care services are delivered by compassionate care professionals and range from personal care, meal preparation, and medication management to Alzheimer's care and hospice support. Visit homeinstead.com to learn more and to find a location near you. Now, let's discuss the resources available for caregivers and aging adults dealing with hearing loss. Organizations like the Hearing Loss Association of America offer some really valuable information. They also have support groups and advocacy efforts to promote awareness and accessibility for individuals with hearing impairment. Local community centers, senior centers, and your healthcare provider can also provide some resources and services tailored to addressing hearing loss. So it's really important to do some research on what's available in your area. A few years ago, I had a great conversation with the author of the book, Hearing and Beyond, Living Well with Hearing Loss. This book is written by Sherry Eberts, and I've linked to the video of my discussion with Sherry, and I've linked to her book in the show notes. It's a great resource. In our discussion, Sherry offered a few strategies that I want to share today. The first is to encourage the individual and the caregiver to adjust their mindset. The negative feelings that are associated with hearing impairment can prevent a person from living well with hearing impairment. So instead, you can approach it from a place of, I want to communicate better. An important part of communicating better is evaluating what you can do to improve the situation. So maybe it's more light for lip reading, or being sure you have the person's full attention before you speak to them. It's also important to tell others what you need so that you can communicate at your best. This can also be a really hard thing to bring about, and to tell somebody what you need or to ask for help, but it really can benefit all parties involved in the communication. And then you also need to regularly reevaluate. For example, if you ask someone to speak louder or to talk slower, over time, they might forget. They might start to talk softer or talk faster. So you'll need to remind them, okay, can you please talk slower, slow down, or talk a little louder? So I want to thank Sherry for that great advice, and I really hope you check out her book, Hearing and Beyond. Next, when I think about the tools that someone can use to address hearing loss, we usually think about hearing aids. That's what comes to mind automatically. But what's interesting is that only 20% of people who could benefit from a hearing device actually uses them. This could be due to a variety of things. Again, back to that stigma, or maybe it's a lack of awareness about the options, or it could also be the cost associated with them. But what's really exciting is there's now over-the-counter hearing aids that make them more accessible, and they're also making sleeker styles that are less noticeable. So hopefully these combination of things will lead to more people being open to wearing hearing aids and other hearing devices. Beyond hearing aids, you can also utilize technology. You can utilize it in the form of closed captions, like a closed caption telephone. You can request caption readers at places like the movies, or you can use devices that are referred to as hearables. Hearables are not necessarily made for people with hearing loss, but they can be used to enhance hearing. And I want to give you two examples. So one is the company Bose. They have a headphone product that can actually amplify sound. So you could try those. Or the Apple AirPods Pro, they can also be used for the same thing, to amplify sound. So these tools may be helpful to help an individual with their hearing. Or if they're super resistant to hearing aids, it might be a good first step, something to try. I do want to talk about these tools for just a moment. It's important to recognize that while these tools are really, really helpful and they can make a significant impact, hearing aids and sound amplifiers won't make the person hear like they used to. Some people have this misconception that hearing aids are like prescription glasses, and you can, with glasses usually get back to that 20/20 vision, but actually hearing aids, they don't work quite the same. So again, hearing aids will help improve your hearing and can help the person better engage in conversation and participate in activities. But it's important to have those realistic expectations that it's not going to bring you back to what your hearing used to be. It's also really important to undergo hearing evaluations and explore the options with a qualified audiologist to find tools that will best fit the individual's level of hearing loss. Then if we look beyond the technology, it can be helpful to focus on things you can do to foster better communication. First, set the conversation up for success. Make sure you're facing the person when you speak to them and get their attention. That way, they don't miss part of the conversation or the context of the conversation. And this might require you to go to that person instead of shouting from another room. You also want to face them directly, speak clearly, and at a moderate pace to help improve comprehension. You don't have to shout or speak extra slow. This can actually distort the lips if they're used to lip reading. And again, a moderate pace with a slightly elevated tone is helpful. And it also can help give them more time to process what you're saying. But something to be mindful is covering your mouth or chewing food while talking, because this can also impact a person's ability to read your lips. This makes me think back to the pandemic when we were all wearing masks. Take yourself back in time to when that was our reality. But it made me realize just how much lip reading helps us understand what is being said. During that time, I felt myself physically leaning closer to hear people and to ask them to repeat themselves because I couldn't see their mouth move. I guess I didn't realize just how often I use lip reading myself. So be really mindful when you're interacting with a person with hearing loss not to block their view of your mouth. And you can also use visual cues such as gestures or even writing down important information to enhance your communication. Next, you want to watch out for comprehension. If they're having trouble hearing, that person may lean forward, they might look confused, they might disengage in the conversation or even look away. So you could take these as cues that you need to speak louder or talk slower, or you might even just be direct and ask them, "Can you hear me okay?" Also be sure to check the environment. Make sure there's adequate lighting to help them see the person who's talking. Also be aware of any background noise like the air conditioner or music. You may need to turn off the noise if possible or move to a quieter space. And if you're not face-to-face talking regularly with someone, but instead you talk with them frequently over the phone, you can look into that closed caption phone I mentioned earlier, or you can even use FaceTime or Zoom so that that person can get those visual cues in addition to hearing the conversation. And on Zoom, you can turn on closed captions, which is another great feature. And finally, have patience with your loved one. Be prepared to repeat or rephrase things. Also, don't be afraid to bring a little lightness to it with some humor. This can be a heavy topic, but just be sure you're laughing with them and not at them. And my final tip that I want to reiterate is to keep regular hearing screenings for your aging loved one. Even if the person isn't exhibiting many signs, it can be really helpful to have a baseline assessment of their hearing, and then over time that allows you to address any hearing issues that might come up. So as we wrap up today's episode, I hope you have learned a few new tips to help you with these hearing loss challenges. By understanding the impacts of hearing loss and the available resources, we can create a more inclusive and supportive environment for our loved ones as they navigate this aspect of aging. I would love to hear from you on your caregiving tips that involve hearing loss. You can email me at caregiverchats@homeinstead.inc, that's homeinstead INC, with your tips. I also hope that you'll join me for the next episode of Caregiver Chats, where I'm going to talk all about fall prevention. Falls are something that many older adults are often afraid of, and there's a lot we can do to be preventative. I'm excited to dive into this topic with my friend and fellow gerontologist, April Ibarra, so I hope you'll tune in. I also invite you to follow us on Facebook at Homeinstead Inc., that's Homeinstead INC, for previews of upcoming episodes, caregiving tips, and more. You can find all of the links in the show notes. Thanks for listening, and please remember to take good care of yourself while you take care of others. Caregiver Chats is brought to you by Homeinstead. If you're looking for in-home care to support you on your caregiving journey, please visit homeinstead.com/caregiverchats to learn more.